Hello everyone, my name is Dr. Robert. I'm medical doctor and an occupational health assistant physician. It's a pleasure for me to do this presentation with you today where I'm going to be talking about HIV. The title of my presentation today on this occupational health sensitization presentation is HIV in workplace, information and prevention. So, as an occupational health physician, it is important to raise awareness. It's very important for us to raise awareness among employees about the risks of HIV. We are in the month of December, and the 1st of December is tackled by the WHO as the International Day to raise sensitization on HIV. HIV being a serious disease that can be transmitted through contact with infected body fluids or through or that can also be transmitted from one person to another through various means that we're going to be talking during the presentation. It's important that in a workplace where we have to deal with people, we are having physical contact with people, it's important for us to understand how this disease can be transmitted and how it can be prevented. In this context, we're going to be discussing a preventive measure and how to manage HIV related work situation. So to begin with, what is HIV? I'm going to begin with that. What is HIV? Like, we're talking about HIV. For us to be able to deal with it appropriately, it's important for us to understand what is HIV in the first place. I'm going to begin by saying that HIV is a virus that can attack the body immune system. It's a virus that pathophysiology is geared towards attacking your immune system. Your immune system is simply a system that was put in place or that is in place to help you fight against any infection or any disease that is caused by an external germ. It can be bacteria, it can be a virus, it can be fungi. That system is there to help you fight with that. When you have a disease like HIV, which is in your body or in your system, is fighting that your immune system is very dangerous because it leads you to a condition that is called immune deficiency. So HIV is one of those diseases that attack your body immune system. It can be transmitted by contact with infected bodily fluids. We're talking about blood, semen, breast milk, and etc. It can also be transmitted through unprotected sex with an infected person. It can be transmitted by sharing needles or contaminated injection equipment, and as well through blood transfusion. That's you being transfused with an infected blood. That's going to lead to you being contaminated as well by the same disease. Now, what are the risks? What are the risks of HIV in workplace? HIV risks in the workplace. Now, employees who work in the following sector or in the following environment have a higher risk of contracting HIV. Now, you're listening to me, you're an employee, you're working somewhere, you're working in a certain company, you are at higher risk to contact HIV or to come in contact with this infection if you work in this particular environment. Number one, those are working in the healthcare system. You work in a hospital, in a lab, in a clinic, anything related to healthcare, it makes you in higher risk of contracting this disease. Those that work in emergency services are also at higher risk of contracting this disease, and of course, those that work in the sex industry. However, it is important to note that HIV cannot be transmitted by these various means because it's important for me to also deal with the misconception about HIV. HIV cannot be contracted by these various means. Number one, HIV cannot be contracted by casual contact like hugging someone or giving a handshake. No, HIV cannot be contracted by giving a handshake to someone or giving a hug to someone. It's not possible. Next, HIV cannot be contracted by sharing food or drinks. No, it's not possible. You cannot get HIV by sharing food or drinks. That's not a means of contamination of HIV. You can't get HIV that way. And HIV cannot be contact with contaminated surface or objects. Like someone has been sitting here, another person is HIV positive, so I can't sit there because I may know it's not possible to get HIV that way. Now, what are some of the preventive measures that you can put in place to make sure you're safe or you can't get in contact with this disease, even while being in an environment that is very high risk of you being in contact with this disease? To prevent HIV transmission in the workplace, it is important to follow the following prevention measure. Number one, you have to use gloves and masks to protect the skin and mucous membrane. You have to use gloves and masks. I'm talking about nurses that are dealing with patients, that are dealing with people that are contaminated and have maybe dealing with sharp objects, sharp things, or that can get in contact with direct fluid like blood and other semen. Putting on gloves or mask is going to be very protective. Next, avoid sharing needles or injection equipment at maybe a place of work or at home even. But here I'm focusing on the working environment. Avoid sharing needle environment, blades, needle, any other thing, anything that's sharp. Avoid sharing them. Or use protective measure in case of sex in working environment. It's going to reduce the risk of being contaminated if one of the partner is contaminated. And getting HIV regularly checked up, getting tests for HIV at least once every 3 months. That's what is recommended by the WHO. Now, managing HIV related work situation. Managing HIV related work situation. If an employee is infected with HIV, it is important to follow the following procedure. Maybe you have contracted a disease, you were diagnosed in hospital, and you know you are HIV positive. Now, this is supposed to be put in place. The first thing is confidentiality of the infected employee, because HIV is a disease that still have a lot of stigma from people that don't understand. They don't understand what is it all about. They still have this stigma, and to avoid that, it's important to maintain confidentiality of the infected employee, provide information and advice on disease management, adapting working conditions to avoid the risk of transmission, adapting working conditions to avoid the risk of transmission, and provide training and information to employees on HIV prevention. Like what you are doing now, this training that I'm sharing with you, because I'm working with you as your occupational doctor. This, because of the knowledge that you are getting from this presentation, is going to help you to relate better and to have more understanding on this disease. It's very important because we all know the saying knowledge is power. That's true, because of more knowledge has come to you now, more information has come to you now. You can relate better with this disease. So finally, I'll conclude by saying that HIV is a serious disease that can be transmitted in the workplace. It is important to follow HIV prevention and management measures to protect your health and your safety as an employee. So thank you for following this presentation to the end. If you have any question concerning this topic on HIV, you have any worry, any concern, kindly leave a message in this group, because see you in our next video, where we're going to be having another presentation on another work-related issue or occupational-related issue. Thank you very much for following to the end, and see you. Bye.